How to conduct a first aid primary survey. What is the primary survey? The primary survey is a quick step-by-step process that anyone can use to identify, treat or exclude the most life-threatening conditions that might be present in a medical emergency. The primary survey follows a logical sequence of steps. When doing the primary survey, you simply follow it one step at a time, dealing with the problem you find or moving on because it is not there. The primary survey should be used at the start of dealing with any medical emergency. The primary survey consists of danger, response, airway, breathing and circulation. Danger. Make sure you check for danger. This means danger to you, further danger to the casualty, and danger to bystanders. Think about this burning car. What dangers might be present that might hurt you if you went to try and help? Check for response. Where are they on the Avpu Scale? If they are responsive and able to answer questions, ask them about what happened. If they are not responsive, move on to opening the airway. In this scene, the first aider is using pressure with his fingers to try and get a response from the casualty. The Avpu Scale. You can use this to judge the responsiveness of a casualty. Are they alert, aware of their surroundings, and able to speak to you clearly? Are they only responding to voice, which means they only respond when they hear your voice and their response might not be full? Do they only respond to pressure or touch, or pain from an injury? Or are they completely unresponsive when they do not respond to anything at all? If the casualty is unresponsive, tilt the head back using the head tilt chin lift method. Does the person become responsive? The next slide shows the head tilt chin lift. Breathing. Check for breathing for no more than 10 seconds. If they breathe less than twice in 10 seconds, or the breathing is absent, or it does not sound normal, then they are not breathing normally. Call 999 or 112 and ask for an ambulance. Send someone for a defibrillator. Start CPR. How to check for breathing. If the casualty is breathing normally but unresponsive, if they are uninjured, you can roll them onto their side using the recovery position if you know how to do that. If they are injured, leave them on their back and only consider moving onto their side if you believe their airway has become compromised. If the patient is not breathing normally, start CPR using the current resuscitation guidelines for adults or children. Before you start CPR, send someone to get a defibrillator. As soon as it arrives, set it up and start using it, following the recorded voice prompts. Carry on CPR in between analysis and shocks, and do not stop CPR until the ambulance arrives. Circulation. Check for circulation problems like bleeding or shock. You have now completed the primary survey. If you have reached the end of the primary survey and the person does not have any life-threatening airway, breathing or circulation problems, you can move on to the second survey.